A number of COVID-19 vaccines are on their way of getting through the approval process, but disease experts have a heads up. The virus is probably going to be a threat well into next year, regardless of what happens with the vaccines. Thanks for staying with us for local coverage at 6:30. I'm Patrick Nolan.
And I'm Jane Monreal. Experts are pointing blame at Americans who say they will not take the vaccine. Fox 4's Rachel Lloyd has the story.
A Southwest Florida epidemiologist says the 50% of Americans who are on board to take the approved COVID-19 vaccine isn't enough to stop the pandemic. On top of that, he says we may even need a new one in years to come. Gearing up for the COVID-19 vaccine, Lee Health and Naples Community Hospitals have already purchased freezers like this to store whichever vaccine gets approved. Epidemiology professor Dr. James Copeman has faith in both the Moderna and Pfizer vaccines that are currently in the last stages of testing, but he doesn't think they'll have the intended effect on the pandemic overall.
Reduce it, but we won't get it under the control that we need to get it under.
He says that's because not nearly enough people will take the vaccine. Some Fox 4 viewers shared on Facebook they would get vaccinated. Others said no way. A Pew Research Center survey shows only 51% of Americans would take it.
Old people like me are still going to be really hesitant to interact with anybody, right? Because it's still going to be a threat.
He says the U.S. is in the middle of its second surge of COVID-19 as cases spike across the country, but part 2 of the epidemic could come next.
It's in the second year, you know, when you start getting reinfections, that this phenomenon starts to emerge.
He says that's when the virus will evolve. People who've contracted it may get it again, and in that case, a new vaccine would be needed, maybe as often as the flu shot. Rachel Lloyd, Fox 4.